Nob said, I am combining my icebreaker with a speech I'm going to give in about a month at the American Dental Association's annual meeting in San Francisco. Yes, I grew up on a small farm about 3 or 4 miles outside of the town at 300 people. It wasn't exactly in the middle of nowhere, but it was near there. So my first and second grade, I attended a one-room country school. We had a hand pump well out front for water, a wood stove in the middle of the room for heat, and outhouses in the back. When I was growing up, my favorite book was this little golden book called Scuppers the Sailor Dog. Scuppers had a little boat and he sailed all around the world. He had these great adventures. He wrecked on an island and he finally repaired his boat. And I don't know whether that's what planted the seed, but in 1998, or 99, I took a 1-year sabbatical on this boat with my family. We spent a year sailing all up and down the Caribbean, from the west coast of Florida to Trinidad off the coast of Venezuela, and then eventually back up the Chesapeake, hitting most of the islands in the Caribbean and the Bahamas. As Anab said, one of my other passions is photography. These two images kind of represent my transition from the farm, where we used the wind to pump water for the livestock and windmill, to a sailboat where we used the wind to propel us across the ocean. I enjoy taking pictures of flowers. I also like abstracts. This is actually a picture of flowers. Some more flowers. This is my office. As Anab said, I'm an endodontist, a dentist who does root canals. I know you've all heard the jokes, but anyway, and I'm trying to transition into where I speak more in the continuing education circuit. And I'm speaking in San Francisco. The topic is finding cracked teeth and deciding what to do about them. So cracked teeth, as we all know, are sometimes very difficult to find. And once we found them, we need to find how deeply into the tooth those cracks go. The depth of the penetration will dictate your treatment plan, because the bacteria in the crack will cause pulpitis, pulpal necrosis, and periodontal breakdown. So this is, if left untreated, a cracked tooth will eventually progress from the top of the tooth and into the root and eventually split the tooth. Rick Walton at Iowa in 1984 published a study where he showed that bacteria are in the fractured spaces, and those bacteria cause tissue destruction. And as you can see from the slide, there are bacteria in the crack and a lot of inflammation in the periodontal ligament beside it. So what are the steps in detecting a crack? You need the dental history. Was the tooth restored in the past? Get a thorough signs and symptoms subjective. Hot and cold bothers them, hurts the bite. In your visual examination, it's important to use magnification and transillumination, as well as your tactile and percussion. So here's a tooth with the direct light. You can see some of the cracks along the tooth, but it's hard to tell from that how deeply into the tooth goes. Whereas when you transilluminate it, the crack breaks up the light, and it's light up to the crack and dark the rest of the way through, whereas if the crack doesn't go deeply into the root or the tooth, it extends on. Radiographically, the classic signs in the traditional two-dimensional x-ray are these J-shaped lesions that you see along the side of the root. Again, cracks are full of bacteria. Bacteria cause bone destruction around the tooth. We now have three-dimensional cone beam CTs, or essentially CAT scans for teeth. So what we can do with this technology, instead of having just one view of the tooth, we can view it at any angle in thin slices. If you look closely, you can see that the lamina dura is not there on the 2D, but sometimes that doesn't show up. But on the 3D, it definitely does show up. You can see the level of bone loss caused by the crack. Here's another case. Initially, it looks like there may be inadequacies in the root canal, but the 3D shows us that there's definitely a split in the root of the tooth. Another case, crack visible on the exam. There's a lingual sinus tract, which very often is a sign of a crack. The two-dimensional x-ray really doesn't show much of anything in this case. but the 3D X-ray definitely does. We can see the bone loss all along the sides of the roots, and even on the three-dimensional reconstruction, you can see it. So again, comparing the 2D and the 3D, we can definitely see the advantages of the cone beam three-dimensional X-rays. So in summary, cracks can cause irreversible pulvitis. The cracks also cause periodontal bone loss. We encourage you to use magnification and transillumination during the examination. It's important to use both 2D and, if available, the 3D cone beam X-rays. Look for cracks at every tooth you examine and restore. And remember that you can only find cracks if you look for them. So look for them in every tooth. Any questions? Thank you very much.